Hey there, it's Dr. Jim. Thanks for stopping by again. I appreciate it. It's always good to spend time with you. Uh, my episode is nurses and PTSD. Just wrote this, and it's something that I have not paid attention to for a while, and I kind of forgot about, but it's something that is extremely important. Nurses and PTSD. Being a nurse in any healthcare setting today, especially today, is full of daily challenges, stress, and sometimes occupational and emotional burnout. What is much worse is when nurses experience a traumatic event of some kind and then develop post-traumatic stress disorder or PTSD. Some nurses may present behaviors including irritability, tearfulness at work, detaching from their coworkers and their job, their leadership, or maybe some type of personality change is taking place. While this may not have been a focus of prevention or research in the past, post-traumatic stress disorder among nurses is now gaining a lot of attention, as it should, and is now considered a very serious mental health problem that demands more research and a lot more awareness. According to the American Psychiatric Association, PTSD is a condition that might develop after experiencing or witnessing a traumatic event, like a serious accident, a natural disaster, or terrorism, for instance. People with PTSD have very intense and disturbing thoughts and feelings that are associated with that experience. They might relive their experience through things like you've heard of before, I'm sure, flashbacks and nightmares. They can experience sadness, anxiety, anger, detachment from people around them, avoidance of places where trauma occurred. All of those are quite common. Now, symptoms of PTSD fall into four categories, including intrusive thoughts, avoiding reminders, negative thoughts and feelings, and arousal and reactive symptoms. It's reported that over 3 million cases of PTSD are diagnosed each and every year in the United States. It's also estimated that 1 out of 11 people in our country will experience PTSD sometime in their life, and women are twice as likely to develop symptoms. But why nurses? The episode is on nurses and PTSD. Healthcare is stressful and complicated. It's full of demands and unpredictable changes. Organizations, patients, and families may all have very unrealistic expectations of nurses. Each year, it seems that nurses have to keep doing more and more with less and less while trying to deliver high levels of clinically superior and ethical care. It's estimated, this is staggering, I did not know this, that up to 14% of nurses experience symptoms that do meet the criteria to be diagnosed with PTSD, which is 4 times greater than the general population. In my mind, that's a big deal. That's a big problem. But I'm out of time. Please do your research. Dig into nursing and PTSD. See what you could find. Share it with your friends, your colleagues. My name's Dr. Jim. Thank you so much for stopping by. Take good care of those nurses out there.